welcome to another Vet Chat from Vet Match. We're here to explore yet another focused topic, and I think today we're going to find some incredible information that you can utilize to discover perhaps yourself and even more about others that you're working with. Lots of surprises likely in today's conversation, and I know this is a valuable asset to be adding to our library. These are here. Join us every second Sunday at 6 o'clock for a time. Next one in July, we are having an open forum discussion so that there's no topic unless it's one that you are bringing up. And I know that you always have lots of questions, lots of thoughts, and we'll celebrate what your successes are. We're going to make that happen. So join us on the second Sunday in July, same time, same place, and go from there. Today, I'd really like to welcome an incredible guest speaker that we have, Dr. Laurie McCauley. Dr. McCauley and I go back a long, long way. We met back in Colorado State University. We are classmates in veterinary school. It's definitely a pleasure when we reconnected for me to have seen all the progress and the amazing accomplishments that she has had and made and is still in the cusp of creating more of. And so thank you so much for joining us today. Dr. McCauley after she did some GP for a few years, she went into something that was pretty innovative at the time. It was rehabilitation. It seems like the commonplace thing now, but there was a lot of groundwork to be made, and she was one of those pioneers. In fact, she was so much so that for the work that she's done, she's become, she was the 2011 IAMS AARV Award of Excellence in the field of rehabilitation. And in 2015, the AHVMA Holistic Practitioner of the Year. Pretty impressive. She is a prolific writer, author, and global speaker, and I'm so delighted to have her here. She also has her own company, Optimum Pet Vitality, in which she's empowering veterinary professionals to learn how you can also apply the valuable resources of laser, of nutrition, of so much more in rehabilitation for animals. She joins us today, though, for a very different topic. Today, we speak about neurodiversity. So with that being said, I'm going to start a little bit on the high level global view, Dr. Laurie. Dr. Laurie McCauley, welcome.
Thank you.
How are you doing today? Woo-hoo.
Awesome.
Cool. I love knowing what people's journeys are. Can you share with us how you got from there to here?
Sure, absolutely. So I did 6 years of general practice, and truth be told, I got bored. And after, there's only so many vomiting dogs and diarrhea and cats and liver failure, and it just wasn't really super fun anymore. And then I fell down the stairs at 3 a.m. putting my dogs out, and my chiropractor couldn't fix me. I hurt my back. And they sent me to a surgeon who said, "You don't need me." And he sent me to a physical therapist. And I went, "Oh my God, this is so cool. This is what I want to do. I could help this one and this one and this one and this one." And from there, I started the first rehab clinic. I designed the first underwater treadmill. I designed the first soft carpal brace. And what I thought was going to be a 6 hour a day, 3 day a week thing exploded. It mushroomed. Now it's the fastest growing field of veterinary medicine. And I am so blessed to have been able to start it, and started because I think outside the box. So I did that. I've had interns from around the world. I learned from every one of them as much as teach them. At 55, I heard a podcast on We Can Do Hard Things with Glennon Doyle, and she had Hannah Gadsby on, and she's a comedian, and she talks about growing up and having autism. And I thought, oh, okay, whatever. And then I went, my brain works like that. My brain works like my brain works like that. That's not normal. That's different. And I went to my therapist, because I have a therapist, and she said, "I don't think you're autistic." And so she said, "Well, listen to this podcast by this autistic psychotherapist. who trains other psychotherapists about autism. And I listened to it and went, my brain works like that and that and that and that. So I had the professional diagnosis, and at 55 was diagnosed with autism. And in typical Laurie
Wow.
fashion, I said, hmm, well, if my dad was alive, he would have called me retarded, and that's not who I am. The other thing I learned is that I'm in the 97th percentile for intelligence for women my age, which helped me tremendously. So I studied as much as I could, and then at about the same time, I got asked to be the keynote speaker for the American Holistic Veterinary Medical Association, and had this really strong feeling that I had to lecture on neurodiversity, which was extremely vulnerable, right? Imagine standing in front of 350 people that you respect you, and telling them you don't have, it's not a disease, you are autistic, and thinking that they may see you like your dad would have seen you. I
Mm.
studied everything I could. I got brave. I became vulnerable, and it was amazing. I truly believe that there's a huge percentage of neurodiverse people in our field. And when we talk about the different types of neurodiversity, I think you may realize way more than you would think. I literally had at least 10 people come up to me right after the talk with tears streaming down their face. "Oh my
Oh,
God, you understand me. Oh my God, I didn't know why I was different. Oh my God, I finally get it." And then literally 350 people, I would say at least 50 people total came up to me and said, "I am, my spouse is, my child is, my coworker is. Thank you so much. This was so helpful." And I realized that we need to understand this, because when you have when you are neurodiverse and you don't understand it, you don't understand why you're different, it's really hard and you struggle. And once you understand it, you can make it blossom. So
my
that's
goodness.
what
Well, congratulations on that breakthrough, as well as you said, vulnerability, especially in veterinary medicine,
mm,
where we all are strive to be the perfect. And what does perfect even mean, right? You can't have anything that's different. Well, that's the core word of this diversity component. And it's the neurodiversity and the way that people think differently. But that's kind of a novice way of looking at it, I'm sure. And of recent, we're definitely hearing so much about neurodiversity or on the spectrum, ADHD. Temple Grandin, who actually was starting out when we were in veterinary school, we got to hear her speaking. And I guess for you too, and for me, it just didn't even click. What does this even mean? Because that was something that was unheard of back then. So Laurie, Dr. Laurie, what does this all even mean?
All right. So neurodiversity, which actually is very ironic, wasn't even coined until 1998, which is when I started rehab. So, but I like little, patterns and things like that. It literally is a different brain neurochemistry. So it's not something that you get. It's not contagious. It's not a disease. It's not a disorder. It's literally how your brain works. And there's amazing people that are neurodiverse. We have different strengths. We have different struggles. It There was a group of 11 Yale math Olympiads, which is like the top of the top. And when they took an autism test, 7 of the 11 were on the spectrum, right? So
Um,
yeah, so it's not, I mean, again, it's a spectrum. It's not a line. It's not you're here or here. It's not even a picture, like a round picture. It's literally to me like a globe. And you can be anywhere in there and be on the spectrum and find your place and figure out how you can do. I do want to go through the different types of neurodiversity, and then
Please.
we'll talk about two main ones. So there's dyspraxia, which is difficulty planning actions and figuring out ways to accomplish them. There's dyscalculia, which is difficulty with numbers. So you may have people say, "Oh, I'm a veterinarian, but figuring out those dosages is really hard for me." They may have dyscalculia. There's dysgraphia, which is trouble writing or putting your thoughts into words. There's one that when I found out was huge for me, because I was like, "Oh my God, this explains some of the things I deal with." It's alexithymia, which is having trouble identifying and verbalizing your feelings, right? So I could say I feel bad, but there's times where I'm like, I don't know if it's sadness or anger or resentment or any of those things within it. It's really difficult to find that. And I actually found out that 50 to 80% of autistic people have or are, I guess you say have there, alexithymia. There's OCD, obsessive compulsive disorder. And let me tell you, if you have someone in your hospital who is OCD about cleaning or a germaphobe, it is a wonderful gift because everything is clean, right? What you need to know there is the reason they do it is literally to decrease or relieve their anxiety. So their anxiety builds up when what they need to be isn't the way it is. And by doing that, whether it be cleaning or whatever they're OCD about, they can breathe. I literally can't start a big project until my kitchen is clean. It sounds crazy to have that connection, but once my kitchen is clean, I can sit down and I can focus.
Sure, a lot of individuals can identify either for themselves with this particular component, or at least know someone that also does.
Oh yeah. Oh yeah. The next is ADHD. You may see restlessness, trouble concentrating, extremely impulsive. One of the things that drives me crazy. So I should say I am autistic, and my partner, we just got married, my wife, is ADHD. So that's why I study on both sides so that I can help us communicate, right? And then autism, real brief, challenges with social communication, very restricted interests. So I can talk forever about rehab and dogs and medicine, but you asked me to talk about geography or sports or politics, and I'm like, right? Just you guys go talk, and I'm gonna do this over here because no
Right.
interest whatsoever. Um,
Interesting.
so the one thing to know is being neurodiverse is a gift. So if you are and you find out that you are, learning how to work with your strengths and know how to compensate for your weaknesses brings relief and helps you succeed. Um, People who are neurodiverse, super important, have extraordinary persistence and resilience. My dad used to say all the time, "Oh
Hmm.
my God, you're stubborn." And I'd say, "No, I'm resilient and persistent. And that is what's going to get me where I am in life."
And it has,
And it
and it
has.
still is.
And it still is.
Interesting. So when we're considering the big pool of neurodiversity, and I'm sure that we still have much more to discover in the future as well, perhaps that we all have some semblance of this, and that's what it is it's like, here can we focus for a moment on the autism and ADHD, since you probably know the most about those. Can
Mhm.
you kind of give us a rundown on those two dynamics, these forms of neurodiversity?
Absolutely. So with ADHD, you may see so it may be you or someone you work with,
Mhm.
difficulty managing your emotions, your thoughts, and your actions. So like impulsivity, they may be hyperactive, like people who pace, right? I can't sit still. I have to pace. I have to do.
Mm.
They may have difficulty with attention, right? But once you know, hey, I'm ADHD, I need to focus. I can set aside time. I can do time blocks. I can do things to help me manage and help me be the best I can be with what I am, right? I have people with ADHD have trouble starting projects and or completing projects. So a great example of this, when I first was working with Mona, she was the president of the American Holistic Veterinary Medical Association, and she had to write a letter. And after 3 weeks, I'm like, 3 weeks. It's half a page. So, like, I'm writing textbook chapters that are, like, 60 pages long. I'm like, "It's a half a page, just sit down and do it." And her brain just couldn't. So we sat down and I said, "Well, what do you wanna say?" And she would give me bullet points, and then I wrote that into a paragraph, and she's like, "Oh, no, that's not right. It's blah, 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 blah." And from there, she could write it. But the
Interesting.
overwhelm, she just couldn't do it. But again, by working with somebody, if you can see them struggle, you can help them. Really important, comorbidities, right? There's emotional and health comorbidities that are seen if you're ADHD. And it's so important that I want people to know this. Emotional comorbidities, you're more likely to have depression, substance abuse, anxiety, social phobias, panic disorders, be bipolar, OCD, intermittent explosive disorders, and eating disorders. And then there's the health comorbidities, hypertension, type 2 diabetes, obesity, asthma, migraines. And people that are ADHD not only are more likely to have these, but they're more likely to have an earlier onset, increased severity, prolonged duration, increased complications, have it be chronic, and more likely to relapse. So that's like really scary. But if you know in advance that you might have these things, you can prepare for it and work against it so it doesn't happen, or it happens with less side effects. The other half of that is you have to realize there's ADHD greats. So people like Michael Phelps, Jim Carrey, Bill Gates, Walt Disney have all been diagnosed with ADHD, and they're amazing. So people with ADHD have the ability to do amazing things. They're superpowers. And their superpowers are the ability to hyperfocus, be resilient, extremely creative, right? Think about Walt Disney, right? His brother said, I see a swamp, and he saw Disney World, right? They have great conversational skills. They have spontaneity, abundant energy and exuberance, emotional sensitivity, and empathy. More likely to be an empath. Other things, literally their brain works faster than their mouth. So one of the things that drives me nuts about Mona is she talks in half sentences, and my linear brain is like, but finish that thought. But literally her brain goes so fast that her mouth can't keep up.
And I can see that actually being some of these components in a veterinary practice with your team when, let's say, one of the teammates, whether it's the doctor or the technician, has already thought further through the treatment plan and then hasn't quite caught up the rest of the team, while the rest of the team is still wondering what's happening in room 3, the doctor's already moved on to room 5.
Right.
And then wondering why no one else picked up the room 3 pieces.
Right. What's really cool is ADHD people can talk to each other in half sentences and understand each other. And there's like literally there's studies that show that ADHD people versus neurotypical people, ADHD people can talk to each other at a different level and communicate much faster. And neurotypical people can communicate together, not as fast as ADHD people, but when you put them together, there can be a misconnect and it can be a lot harder.
It's important to know.
The other thing is so many people say, oh my gosh, my child is ADHD. Science shows that if your child truly is ADHD, there is a 40% chance that one or both parents are ADHD, right? So there's a genetic component in there. I laugh. I have a good friend. I belong to a group of moms, DVM moms with neurodiverse kids.
Okay.
And we were talking about our kids, and she was talking about her ADHD child and how it must be from the father. And I'm like, oh, girlfriend, you need to look in the mirror, right? But not my place to say, right? Because I'm like clicking off all the boxes. So one of the things I think is important is to help with an identifier, right? So people think, oh, that's got to be somebody else. If somebody is talking to you slow and it drives you crazy, you may have ADHD. If somebody is asking you a question and you've already formulated the answer and is ready to spit it out, but they haven't even finished the question, you may be ADHD. If you have to suppress yourself from answering or from finishing somebody's sentences because you know exactly what they're going to say, you may be ADHD. And I see Madeline popped in and said, so me. Yes, Madeline, absolutely. So you.
So in other words, in a practical application, when you have individual like me, just now interrupting you as an example, I definitely want to bring this point to in a practical setting. When we're finding someone is constantly interrupting and not letting us finish in a team, understanding the purpose behind it. It's not necessarily to invalidate your thought process. They just are moving in their thought process, which is different than the intention of insultation, right?
Mhm. Absolutely. Absolutely.
Good.
Little hints, find somebody like you, right? Madeline popped in. Madeline and Mona, we call them the evil twins because they're both ADHD and they can talk to each other just like that. And I just sit there and laugh. It's really funny. If you do things with people like you, if you allow you to be yourself and creative, your confidence and your self-esteem will grow and you'll have much more fun. When you try to be, when you hide behind and you mask and you're like, I'm going to pretend to be neurotypical, I'm going to pretend to follow everybody else's rules, it's actually inauthentic and your brain literally can put you into a depression. And you can feel ashamed, you can feel shame, and your confidence sinks. So being around people like you and understanding it, I think, well, and research shows will significantly help you. So
Fantastic. So now this is the ADHD component. What about autism, Dr. Laurie? Just tell us a little bit more, perhaps even what your experience has been as you discovered yourself.
absolutely. So in general, in the United States, autism is found in 1 to 2% of the population. Yet they find that they're still writing on it because it's significantly underdiagnosed in women and men actually show up differently, their behaviors and their brain patterns. So it's more, again, we talk about the spectrum and this globe. It's just different. Things that we see: exceptional attention to detail, excellent pattern recognition. And I'm going to stop there for a second. Do you know the story behind Temple Grandin, how she became so famous?
There's many components, so I want to make sure I don't want to let our listeners and me learn. Tell us.
So I had breakfast with her and we were talking about everything. And she's like, well, it was the whole spider thing. And I said, she's like, do you want to see the picture? And I'm like, yeah, show me the picture. So the cattlemen were having problems because they had this roundabout thing that the cattle would have to go through to get to slaughter. And about 3 o'clock in the afternoon, every day the cattle would stop going in. And she took one look at it and said, well, you're asking him to walk into the giant spider. And they said, crazy lady, what are you talking about? The shadows when the sun hit the turnaround thing made it look like a giant spider. And as soon as they were able to change that, the cattle had no problem. And now literally more than half of all beef production places have her design. I mean, she's brilliant, super brilliant.
Interesting. I
We
had not heard that. Again, another application, and fortunately, they listened.
Yes. Yeah. Yeah, absolutely. With people with autism or artistic often have hyperlexia, which is the ability to read early and exceptionally well. We have
Hmm.
very focused, really high, really excellent problem solving skills. So because we see things different, we can look at the problem in a different way and find a solution. So like starting rehab, right? I was just going to do this little 6 hours a day, 3 days a week because I had a new baby. And it's the fastest growing field of veterinary medicine. It's awesome. Let's see what else. Um, comorbidities. If you are autistic, you are more likely to have ADHD, dyslexia, dyspraxia. You are more likely to be hypermobile, have epilepsy or gut problems. Super important. If you are autistic, your eyes are more sensitive to blue light, which means you should never, and this should be for everyone, but more importantly for autistic people, watch a screen, whether it be a computer, a TV, your phone, within an hour of going to bed. So the blue light from that, excuse me, will mess up your melatonin schedule as well as your retinas. So like these are my computer glasses. These block blue light.
Mhm.
I can tell you when I studied for boards, my eyesight significantly decreased because I was staring at a computer screen, reading all kinds of research for hours, like from 5 a.m. till 11:30 at night for 12 weeks in a row. Right. So if you are autistic, and even if you're not, have blue blockers, right? Super, super important. Other things.
Quick diversion, since we all are become so computer centric, and even in the practice, we're using the laptops now, taking them in and out of the rooms. We're using that to any type of communication with our clients. Take that to heed too. It's just taking care of us, right? So thank you for that side note tip.
Yeah.
You can get those. You can get the coating added on glasses. You can get just blue readers that you can just order online or local.
Yeah, absolutely. Take care of yourself because you can't change your eyes. When you lose it, it's gone.
Yep.
Other things to think about, autism can be anything from Rain Man. Remember the old movie,
Oh
right?
yeah.
Where they slap the toothpicks and he's like 296. And they're like, what? Box of 300, and there were 4 left in the box, right? He could see that pattern. People with autism prefer to work next to somebody. So like if you and I were to work, we would work great together if I could do my part and you could do your part and things would come together, as compared to if I'm like putting away the dishes and you come in and you help me put away the dishes, I'm uncomfortable and I will back off and go do something else. Not because I don't want to be with you, but I work better side by side than intermingled.
So let me rephrase that. Make sure that we understand this is a very important aspect when we're working in a team in a practice or any organization. Then, so in this case, what I'm hearing is when we have a task at hand, joining in from the very beginning and working together all the way through versus just popping in and popping out. Did I understand that correctly?
It's working side by side. So if we're doing a project and I have my piece and you have your piece, we're working together on the same project,
Okay.
not commingling.
Okay.
So if we are commingling, I'm uncomfortable. And I may not be able to recognize that until I know that this is something. But once I do, I can choose to put my discomfort aside and work the way you need to, or say, communicate, hey, can we work together so say we're taking x-rays or putting in catheters. Why don't you go get the drugs and I'll put in the catheter, right? So we're
Mm-hmm.
each doing our own thing, but we're still working together on this dog.
So same as going into the kitchen, you're putting in away the dishes. I would come in and put away the forks and knives.
Yeah, perfect.
Perfect. Thank you for that clarification. I think that is also a very valuable lesson and tip.
Oh yeah, absolutely. And again, for people to understand if that's how they work better, that
Mm-hmm.
they then verbalize with other people, this is my comfort zone. And we can choose to sometimes work the way is more comfortable for you and sometimes the way is more comfortable for me, because they may not understand it. There's masking and camouflage. So people who mask and camouflage, they go to work and they may be like, my non-doing anything face is a happy smiling face, which is a mask. It doesn't tell anybody what's going on inside my head. People with autism, sometimes they say have less of an affect. They have no emotion on their face. So you may see somebody staring off into space and they may have no affect and be like, I wonder if you go to work and you're happy and bubbly and everything is great and you're energetic and you come home and oh my God, you are exhausted. It may be because you're unauthentic, because you're showing that side of you, or you're masking to be what people expect to be rather than being yourself.
That's a key factor too. And again, for self-preservation, and when right now, when we have this high crisis of wellness and in our team members and our professionals taking care of each other, this is such a important facet. Thank you for sharing that.
Sure. Another thing that we see is something called mirroring. I was at a Tony Robbins event and they went through this and it shocked me. I do this. I didn't know I do this. So like if I'm talking to you and I follow what you're doing,
Yeah.
that to our clients, they actually will, their brain works so that they will feel more comfortable with us. Yet
Yes.
when it was done to me, I felt totally invaded. Like someone was coming into my space, totally uncomfortable.
You
So that's,
picked it up a lot quicker.
yeah. Oh, yeah, yeah, yeah.
Interesting.
I realized I was doing it. Other things, inappropriate laughing or giggling, repetitive behaviors. We all think of like Penny, 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 right? With Sheldon
Mm,
from the TV show.
yeah. Big Bang.
Yeah, 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 yeah. Lack of proprioception, right? So you may like feel a little bit clumsy. It can be from that. Audio processing disorder. So like if I'm in a room and there's 4 conversations going on, I hear none of them. Unless I am totally drawn into one thing, I can't, my brain can't process.
Mhm.
It just can't. If there's a TV in a room, literally, I have a big screen TV so I can teach. I don't watch it because I can't have a conversation with you if there is a TV going anywhere in the room. My brain can't do it.
Need that focus.
Yep. Yep. Uh, Other things, interesting relationship with humor. So like I can listen to comedians all day long and not laugh at all, but you tell me a dad joke and I will just giggle. With my goat, I would literally for over a year come out every morning and go, "Hi kids," right? Because we had 2 goats. It's silly. We don't connect through small talk. It has to be something interesting for us to be able to communicate. Facial and name recognition. I think a lot of veterinarians see this. I have face and name blindness. So when I go to meetings, I always tell people, if I look at your chest, I promise I'm not looking at your chest. I'm trying to read your name. I've literally had people who have spent a week or 2 doing an internship living in my house, see them at a meeting 2 years later and not be able to say their name. I recognize their face. I'm like, "You look a little familiar." And they're like, "Lori, I lived at your house for 2 weeks." I'm like, "Ee." So if that happens, and what's really crazy is I can remember a dog's name like that. It's just people, but it's my brain. Knowing that takes all the stress away, right? Because then I'm not yelling at myself all the time. Like, oh my God, you're so stupid. That person lived at your house. How can you not remember them? I can accept it and say, listen, I'm sorry. This is who I am.
Yeah. These are lots of cues that I think all of us will likely have heard someone say or witnessed it or experienced it ourselves. And seeing them laid out like this, Dr. Laurie, is invaluable, absolutely invaluable.
One
Um,
last thing with
oh,
autism,
yeah.
one last one, I promise.
Oh, yeah.
Time blindness. And I know a lot of vets who are like this. Well, I tell my clients because I own my own business now, right? Red Tail Rehab. I say I never promise to be on time, but I promise that when I'm with you, I will do everything in my power to help
Mhm.
you and your dog to the best of my ability. But when I'm working on a patient or when I'm focused, hyper focused, I have no concept of time.
Interesting. And that's where people can help you, right? That's where we have
Yes, I have my board.
our kind of coaches that the bowling alley gates that keep us bounces and back into time. So you've gone through a lot of dynamics between, in this case, we just used the ADHD and the autism as examples. Like obviously, you mentioned there are many other forms of neurodiversity. Um, one word, I say this, well, how many of you, as you're listening to this, you might be starting to feel like you're running into a category of your own and you're starting to experience, well, wait, I identify with this, I identify with that. That's happened to be, or this has been going on with my significant other. What are some tendencies that we would see in a neurodiverse? I know you give a lot of different examples, but the tendencies, but I'd like to take that into another level when you're finding or you're suspecting that someone else may be in this neurodiverse pattern. Not that it matters that they're identified, but it helps us understand and better work with, around, through some of these sometimes challenging dynamics. What do you do, and how do you handle someone that is like, oh no, that's just a label, I don't want to deal with that at all? Are there some tools, and we may be jumping ahead a little bit, but are there some tools that someone can use when they're working with a team member, or a supervisor, or an owner, or someone that they are supervising, to help them identify some of these factors and then follow through with, well, what can we do for them and help them?
Sure. Um, One of the things I'll say is recognize that if someone normally has a calm personality and all of a sudden they seem overwhelmed or stressed, or maybe you might type it as like bullying, realize that may be their form of a cortisol release, right? So when a, a neurodiverse person gets overwhelmed,
Mm-hmm.
there's cortisol is released, right? We know this functionally. And there's the fight or flight, but it's more than that, right? So it can be fight, right? I'm going to come at you. It can be flight. I'm avoidant. I'm out of here. I can't handle this. It can be freeze. Oh crap, I don't know what to do. I'm not going to do anything. Or it
Mm-hmm.
can be fawn. If you know, people are like, and sometimes we see this in like our assistants or things like that, where like, oh my God, I'm so sorry. What can I do? I'm gonna do this for you. I'm gonna do this for you. Realize that's their stress, and you can help put them at ease. And I don't want to say don't allow them, but help them come down from that, because from that position, any of those fight or flights, right? Fight, flight, freeze, or fawn, is a cortisol release that will lead to compassion fatigue and burnout. We'll see meltdowns, which is an outward show of one of those things,
Yeah.
or a shutdown where they literally won't talk about anything. It's the dorsal vagus nerve disconnects us from the world around us, and we become numb. So you think about people who, when they're in a really stressful situation, they are just matter of fact, like our ER doctors and things like that. They can get through anything because they're numb to everything. And it's not necessarily a good place for their brain to be.
And it's literally chemically damaging,
Yes.
and there's nothing that they can do about it,
Right.
because that is the neurosensory process moving through.
Yep.
So what is the best way that we can teach teams about neurodiversity?
I'm going to go back one more second to what we can do. I have a tool that I recommend for hospitals is to get a stuffed animal. So we call it the pink elephant. And it's a stuffed animal that looks cute, and it's somewhere where everyone can see it, but it's up high. And then when you or somebody around you is stressed, you don't say anything, right? Because sometimes just confronting them will make them break down, and nobody wants to be there at work. So the elephant comes down, and everyone knows that somebody needs a break. And they're just extra compassionate and empathetic and helpful. And he who took the elephant down is the only one who can put it back up. So you can't have a manager come in and say, oh, this is ridiculous, we have to go back up, because then you've just negated everything you're trying to do to be compassionate and helpful. And if you see somebody who is bullying, or they don't realize how assertive they're being, toss them the elephant. So they know, hey, I see you. I care about you. The elephant's now yours. And then they can put it away if they want to. But then it's a more direct, hey, I'm trying to help you.
I love that, bringing the attention out just a smidge more into the conscious level. There, I love that. Thank
Yeah.
you for bringing that up. What are some other things that we can do to help educate those around us for neurodiversity? And this might even funnel into what I really want to get cruxed into is the communicating factor. How do we communicate?
Soft. If you talk fast or lean in or high pitched, it makes it much, much worse. If you lean back and go slow and deeper, it's much more calming, literally to the brain.
Mhm.
So, and if one of the things I love is when someone says, "What can I do to help you?" Right? It's not judgmental. It's, I see you're struggling. How can I help you get through what you want? And I always say, if somebody has done this for you, you should be the first one to jump in for somebody else, right? It's not an excuse. It's not a, well, this is who I am, so I'm going to be this way. It's, wow, you help me. I want to help you. And that brings camaraderie within the team.
And that's
Uh,
how it should be anyway, right? To anyone. That's just a
yeah,
respect level.
yeah, neurotypical people get overwhelmed too. So be kind. Um, what else? If you can have a dark, quiet place for somebody to go. I had a conversation with a bunch of people at a restaurant once that said it was absolutely crazy. When they were running, and people would just say, break, and they would walk outside and do deep breathing for like 5 to 10 minutes. And
Yeah.
everybody else knew that. Everyone else had gone through it, and they would take care of their tables and take care of everything until they came back. And again, not something to be abused, but it was a way to communicate quick, short. I need to get out of here somewhere calm, dark, quiet, not smelly, not candles, because some people are super sensitive to smell. And then come back and know that, again, it's teamwork. We're going to help everybody who goes through that.
These are valuable tips. What are some other things that we can do? Maybe even identifying triggers. What are some things that would trigger? How do we know what these triggers might be? How do we learn them? How do we discover that about potentially ourselves as well as those that we're working with?
Triggers are hard, right? And somebody has to be willing to talk about it, right? A lot of people are avoidant. They don't want to know about it. They
Yeah.
don't, right? So it might even be a discussion where a group has, let's talk about what triggers are. Let's define them. Let's identify them in ourselves, not just in others. And then
Yeah.
helping people realize their own triggers. I know for me, I learn my clients, right? I'm very blessed in that I know my clients very well. And I
Mhm.
see what, don't talk about politics with so and so, or, so and so grandma is, right? You figure
Right.
out which topics not to cover. Um, but if people are open to being vulnerable, being able to identify and say, hey, these are my triggers, right? Don't tell me that I'm doing the math wrong for such and such, right? Because that triggers me and I get angry and I'm going to become defensive and blah, blah, blah. So helping them understand what triggers are and being able to identify it in themselves, I think is huge.
So there has to be a definite recognition and acceptance. Um, the more we know about ourselves and the more that we listen to
Mhm.
others, respect others, just respect everyone's diversity of their own, regardless of where that lies and what it may be. What else would you like for our listeners to know about this topic?
Um, people that are neurodiverse work better with with organizational plans. So if there's a big task to do, having
Mm.
it broken down into smaller, more manageable pieces is very helpful.
Oh, yeah.
Have clear expectations and instructions, like having a manual or an SOP, standard operating procedure. That's helpful. Things with pictures, right? Sometimes they see things, pictures rather than words, right? So more visual things. Having
Right.
organizational systems, allowing flexibility at work. Honestly, the path to having a more inclusive profession literally begins with recognizing and embracing neurodiversity and neurotypical people.
Oh, Dr. Laurie, that is so beautifully said. Whether it's within our own profession, within our own practice, our own organization, our clientele, and then we expand it out beyond. It starts with each of us. It does. It does. So I think you had mentioned that you have multiple resources for our listeners and those people that they know. We're going to have those listed in the chat where you can access those. Do you want to just kind of explain some of those or share some of that? And then I want to make sure we have some time for Q&A.
Absolutely. So if people are going to AVMA, there's a neurodiverse mixer on Monday, June 24th. And Ingrid, I think you were going to put that in the chat if possible. I know
Yes.
5:30 at the Hotel Driscoll Bar at 604 Brazo Street in Austin, Texas. Other places that I recommend getting information, the National Autistic Society, Autistic Self-Advocacy Network. There's an Autistic Women's and Non-Binary group. It's BNND, so for Black and neurodivergent people. There is one group I would recommend staying away from, and that's Autism Speaks. They are a group that raises a lot of money. No one in the group is autistic, and they have a tendency to try to cure. They consider sometimes pretty harsh negative things to try to cure people from autism. So any group that you get into, make sure you look at it. There's groups on Facebook. Again, always be careful before you become vulnerable if you're getting on Facebook. As a vet, DVM Moms, there's Facebook groups that Julie Busby handles. I absolutely adore her. She's wonderful. People with neurodiverse kids. I have one child who is on the spectrum and one child who's ADHD. So again, I have a lot of information on that. So there's that. And then, like you said, in the chat, there's a bunch of screening tools. So there's different websites you can get to take quizzes to say, where do I score on the ADHD or the autism? And realize that these are online tools. They're not a real diagnosis. If you think you are, the best thing to do is to get tested. I do want to throw in one thing. Women with autism are much more likely to have PTSD. I do as well, because men with autism are considered brilliant and powerful, and they're really highly looked upon, whereas women are criticized. They're considered belligerent, unreasonable, malicious, controlling, aggressive, and literally they can get attacked, creating PTSD just because of how their brain works. So again, just be careful. And, if you think you are, get tested, because once you know who you are and how your brain works, it's so much easier. So much easier.
And even with your recent diagnosis for you, um, recognition, shall we say, versus diagnosis, it's just a recognition because you know what? This is who you are. And if any of you feel that some of these signs or what Dr. Laurie has brought forth might apply to you or someone else, that's again, it's a gift. It's a part of you, and it's what allows you to be and provide for the world around you. We love you the way you are, and we want to understand and be able to help you. If you are feeling that you need more assistance, always keep in mind that the AVMA, the Not One More Vet, there are many resources to help you. And if you are in a crisis mode, always remember 988 is there as a support 24/7 nationwide. So, Dr. Laurie, I want to again thank you so much for making this time to share your message, to share your story, and allowing others to learn from this and gain from this and hopefully apply it. and it comes through with the application. I do want to open the floor if there are any questions that anyone would like to have. And when we end our vet chats, we always want to include something that we learned and will be applying in place now, tomorrow, this next week. In that way, if we have an opportunity, we can even share it online today. You can jot it into the chat if you don't feel comfortable saying it, or you can even text or email me or Dr. Laurie. Oh, yes. And also, we'll want to make sure that we have an opportunity how to reach Dr. Laurie. So we'll do that in a minute. And then also the celebrations that you've had over the last month, and then the woohoo, crazy thing, great stuff that's going to have coming up next month. We end that all with a big joint crowd woohoo at the end of this call. So first, let's go ahead and open up. If there's anyone that has any questions or comments, let's get it on. Erica.
Hi.
Hi.
So lovely to see you both today. Just a question. So, do you feel like the way, the social nature of our job can create challenges around navigating social bandwidth for neurodiverse people? And if so, any tips around being restorative around that, if that makes sense?
Say it again in a different way, please.
Yeah. So I am also autistic. And a component of it is how the energy it takes to navigate social situations, right? And considering the social nature of our work, do you have any recommendations for things to help you charge up if you feel like your social battery is depleted?
Yes, find what fills your cup. So one of the things I say is my work fills my cup and empties it at the same time, right? Because it's what brings me joy, and it's what depletes me. So for me, going hiking in the woods where there is no one around, I will never go on a trail where there's lots of people because that just makes it worse. But where there's no one around, surrounded by green, totally fills me up. I may be working out. It may be working with your dog. It may just be sitting at home reading a book, but figuring out what fills your cup and then doing it as needed is wonderful.
If I may add to what you had mentioned earlier, Dr. Laurie, about stepping outside and that breathing exercise, the literal counting of the breaths can help anyone. When you're counting the breath in, 1, 2, 3, 4, 5, all the while just doing that full inhale, pause for a moment at the top, and then counting backwards. 5, 4, 3, 2, 1, emptying all that out. And one thing I've learned too is appreciate that moment, that full empty right before you take your next breath. That is truly when your body is the most relaxed, and consciously consider what it feels like, that peace at that moment. Repeating this step, the breathing in and out. And this is something that I teach over and over in communicating and negotiating and getting ready for an interview, any of the above. They are so valuable to breathing exercises that it just allows you with that. But I love how you phrase it, Dr. Laurie, is find what fills your cup. Because when you consciously think about, well, is this filling my cup or is it depleting it? It will allow that passive perspective. Sorry to jump in.
No, I want to add one more thing that you mentioned. It triggered me. There are, again, I'm a research nerd. There are studies that show that if you put your hands up over your head and look up, or put your hands in Superwoman position and look up and hold that for 2 minutes, that increases your testosterone and decreases your cortisol. as compared to if you lower your head and your spine is in flexion, like you're on your phone, that increases your cortisol and decreases your testosterone. And actually, this is perfect for you guys because they did studies that show that 2 minutes of this, you're much less likely to get a job if you do that for 2 minutes before a job interview. And if you either do this or this, you're much more likely to get a job. Double blind study.
Love it, love it, learned more. Also, pointing out what had happened at the beginning of this question. When Erica came on, she asked it as it made sense to her. And then Dr. Laurie asked her to repeat the question in a different way. This is, again, part of communicating when we reflect and we rephrase to someone else stating something. In this case, she was just upfront and she said, hey, can you rephrase that in a different manner so I can understand? There was no blame. There was no point. There was no shaming. It was just a fact. Could you please rephrase? I just wanted to, we just saw it happen and it was magical. Thank you. Any other questions? Comments? We have a comment here from Cody. Love the pink elephant too. The social agreement is striking. Yes, absolutely. Those of you that are going to AVMA in Austin, Texas, again, please note that we have invite there for the neurodiverse veterinary professionals. It will be on Monday, June 24th. Thank you so much for Erica. I think you're involved with that. We appreciate you sharing that information. There's a QR code or just stop on by. Everyone would be great to see you there. And yes, indeed. How do we get in touch with you, Dr. Laurie?
My personal email is rthawk, HAWK, .143@gmail.com. And if you're interested in learning more about my courses and my teaching platform, it is optimumpetvitality.com. And we have the ability, we have courses on exercise for dogs, on laser for professionals, as well as for pet parents. So pet parent laser courses and pet parent exercise courses. And we are just coming out as of this week. We've just had 1,100 people watch a webinar on fascia, and we have like 150 plus people signed up for our course. So really exciting. We're going to continue to help people help pets because that is what fills my cup the most.
That sounds like a big woohoo moment for you. Congratulations. And Dr. Laurie will also be speaking at the AVMA conference. So be sure to swing by and say hi to her in those. For VetMatch, we will have our jelly bean bar in the exhibit hall. So stop on by. We would love to see you on that because you know what? Once everybody knows what your favorite jelly bean flavor is, that's how we can help you find your jelly bean practice. Some people call them unicorn practices. We call them jelly beans. And if you don't like jelly beans, that's okay. We also have alternatives. So we're approaching the top of the hour. This is a recorded session and we will be releasing it so that all of you are able to access the information and replay it. It is available for our VetMatch members for free. And for those of you that have attended, we make that available as well. So we always close our vet chats with a big celebration. Again, think in your mind for a moment, what has happened in the last month that you can truly own that worked for you, even if it's the tiniest thing that you got through a whole day without getting bitten or scratched. Woohoo! Or it could be the most magnificent, like 1,100 watches, any of that. And think of what's happening this next upcoming month that you are going to be excited about and you are pumping yourself about and raising your hands because you're re-energizing. And we're going to do a quick countdown from 3 to 1. At the end of the one, if you can all unmute, in fact, go ahead and unmute now because we're going to join in with a whole chorus of joint woohoos in celebration of what's happened in the last month and what is yet to come. Are you ready? So unmute now. We're going to go 3, 2, 1. Woohoo! Thank you so much for joining another Vet Chat. This is Ingrid Pika, and we appreciate you being here and everything you do every day.